All right, I think we'll go ahead and get started here. I know a lot of you probably have a lot of things to do this evening or afternoon, depending on where you are, or maybe it's even the middle of the night for some of you. Thanks for joining, everyone. My name is David Hutton. I'm an associate professor in the Department of Health Management and Policy, and I've been at the department since 2010, so I feel like I know a lot about what's going on in the department. I'm also the program director, acting program director, and chair of the admissions committee, so I'm happy to answer any questions you have about that. But today, what I'll do is I'll start off with just an introduction about what the Department of Health Management and Policy is all about. And then we'll open it up for some questions. And hopefully this is an opportunity for you to get a sense of if our program is right for you. You're making some big decisions about what to do in the next couple of years of your life. And we want to make sure that if you're choosing us, that it's the right decision for you, depending on kind of what you're looking to do. So what is the Department of Health Management and Policy? Well, what's our mission? And that's a good place to start here. Our mission is to cultivate exceptional leaders who create and apply knowledge to enhance the health of individuals and communities. And, this is in some ways maybe a general mission, but I think it's very much in line with kind of what we're looking to do. And a big part of this, though, is here cultivating exceptional leaders. So leadership is an important part of what we do. And our vision here is to contribute through research, education, and innovation to designing and implementing an affordable system to improve health and transform healthcare worldwide. And you'll see that in the faculty. The faculty are heavily involved in research. Our students and alums are heavily involved in innovation. And we're, of course, involved in education. That's what you're on this Zoom session for, so learn about our educational mission. We have many different values that we ascribe to. The first is integrity. And we have to have integrity, especially in healthcare, where physicians and administrators maybe have some specialized knowledge about your medicine and the biology and what's going to happen to you. And so we have to deal in integrity. We can't be kind of cheating our customers, if you will, the patients, who oftentimes are very vulnerable. So integrity is incredibly important to what we do in health management and policy. Of course, excellence. We are a top program, and we graduate top students who do excellent, wonderful things. Of course, learning is a value. We wouldn't be an educational institution without that. But we also finally value inclusiveness, collaboration, and equity. And I think these are very nice values here. We want you to feel included. We want all of our students to feel included in the program. We strongly value collaboration, so people are going to be working together. And so inclusiveness and collaboration and equity all kind of work together a little bit. You need for everyone to feel included in order to collaborate successfully. And medicine and healthcare and public health, it is a collaborative endeavor and activity. And so you need to be able to work successfully collaborative. And then the final one is equity. And we want to see equity in our place of work. And also we want to see equity across in the society writ large. And so we strive to find equity within our department, but also we strive to encourage our students to help build and create equity in the world outside of us. And many students, many of you, hopefully, are interested in equity, and that's a value that we share in this department. I want to give you a big high-level picture of the admissions process. So right now you're here at Prospective Student Day in the upper left-hand corner. We hope that you'll think about submitting an application to our program. Our committee will review your application. And I think for many of you, if you're already here at the Prospective Student Day session, you're already interested in the program. You've probably thought carefully about it. You probably are doing well academically, so forth. And so after the application, we do weed out some applications that we feel maybe those students aren't ready for a program like ours, or maybe it's not the right fit. They're looking to do something different than healthcare management or health policy. But then after that, we interview students because we really want to get to know you. And also the interview is not a time for you to better get to know our program. This Prospective Student Day is part of that process, but then the interview is another part of that process for you to get to know our program a little bit better in depth, to see if our program is really the right fit for you. Following the interview, the school makes an admissions decision to admit a student or not. If you're admitted to the program, we also have an admitted students day. So that's an opportunity to come to Ann Arbor, see the campus in person. You're making a big decision about where to live for a couple of years. And so we want to make sure that you're comfortable with the setting. And many students come here and they get really enthusiastic about coming to Ann Arbor to be here for a couple of years in our program. But that's an opportunity for you to get a better sense of what the program is like as well. And finally, you'll make your decision about what you want to do, whether you want to come to the University of Michigan or do something else. And this whole process, a lot of these steps in the process here, the Prospective Student Day today, interview, admitted students day, they're all designed to give you more information about our program because we want you to make the best decision for yourself and your career. And we want to make sure that our program is the right one for you, kind of looking to help you in your career as you're developing that career and want to go forward with that. And there's a question. Let me answer a question here. There's a question here. Are students declined if you make it to the interview stage? Yes. And so we have some declines after the application. We have some declines after the admissions decision. With that said, a lot of you on this session here, I'm sure, are very talented and capable students. And I will say, when we get to the interviews, we've already looked at your application and we're enthusiastic about you as an applicant. So, I think, a lot of the students who go into the interview are admitted into the program. And so, we want you to do your best in the interview, but don't sweat it too much. We're as enthusiastic about you as hopefully you are about our program in the interview. But the interview can be at a time where we do find out that it's maybe not a good fit, that the student is looking to do something different than what our program can deliver. And so there is a possibility though that we do say no to students at the after the interview. But I think again, if you're and that's why we go through a lot of these steps here with the Prospective Student Day and the interview, is to make sure that our program is a good fit for what you're looking to do in your career. So there are several unique aspects of our program here, University of Michigan's Department of Health Management and Policy. We're a little bit different than some other programs. We are really a blend of management and policy. The students in our program will get a little bit of management and policy. We'll talk about in a few minutes about the different degrees you can get. You can get a degree in health administration. You can get a degree in Master's of Public Health. But each one of those will have a different maybe focus on management and policy. But everyone, regardless of the degree you're getting, will get a blend of management and policy. We think that's important, that if you're going to be a healthcare administrator, that you also understand policy. And also, if you're going to be a policymaker, you understand how to be a good manager and understand how people in the management of healthcare operate and think. I think that's helpful for you as you're developing policies. Another unique aspect of our program is the leadership-focused comprehensive curriculum. So it is quite a comprehensive curriculum. We'll go into that in a few minutes. But it's also very leadership-focused. We want, the University of Michigan as a whole has this model, leaders and best, and we take that to heart in our department. We really want to help develop the next generation of healthcare leaders and health policy leaders. So we want you to really transform the healthcare system. And in order to do that, you need to be leaders. And so we want to help you along that journey. Another unique aspect of the University of Michigan's Department of Health Management Policy, or our degree program, is, of course, we've got great classes in our department, but you also have access to resources outside of the Department of Health Management Policy. You have access to other departments within the School of Public Health. So you want to learn a little more about biostatistics or health informatics or epidemiology. You can take some of those classes, but you can also take classes outside of the School of Public Health. So there are some actually good classes in engineering about healthcare management and patient safety. There are some good classes in the Ross School of Business about innovation and financial analysis and things like that. There are some good classes in the Ford School of Public Policy, learning more about health policy analysis. So you have access to some of those other schools at the University of Michigan, which is a very nice resource if you come to the University of Michigan. The last two items here are the access to the alumni network and excellent career prospects, and the two are kind of tied to each other. The University of Michigan, I think we have over 4,000 health management and policy alumni, and they're all doing really great and incredible things. And they're actually incredibly committed to our students. And I've been really surprised coming to the University of Michigan over a decade ago, how committed the alums are. Actually, just today, I was in a meeting with 2 different groups of alums. There were probably like 30 different alums, all enthusiastic about our program and about contributing back to students. They do so with their money, but also, even more importantly, they do so with their time and with job opportunities. So they're very committed to our students and helping you in your career. They hire a ton of our students for internships and for jobs afterwards, and they're just incredibly enthusiastic about our students, and they really want to give back and help support our students in their career paths. And that ties into the last part of excellent career prospects, and we'll see that in a few minutes about kind of the career prospects generally that our students have. Yeah, the students do really well. And really, in the end, our program is a professional degree, and it's designed to help you in your career. So if you don't have good career prospects, that's not good. So we really want to make sure that our program is there to help you along in that career, help you get a good job right after college or right after the graduate degree, and then do well in a good career trajectory following that. Nope, there we go. So again, our program is a blend of management and policy. And one way to think about it is the Masters of Health Services Administration, or the MHSA degree, is really focused on management, but you will get some policy as well. And then the Masters of Public Health degree, or the MPH degree, you'll get some policy, but you'll also get a little bit of management. And if we think about this at a high level, the MHSA is really focused on the organization, financing, marketing, and management of healthcare institutions. So for example, if you'd like to be a hospital administrator, you'd like to manage a long-term care facility, you'd like to manage at a insurance company or device company, something like that, the MHSA is a really good degree to get, understanding those organization and running and operations of management and of healthcare institutions. The MPH degree is a little more focused on the variety of factors, socioeconomic conditions, cultural beliefs and practices, and so forth, that influence population health. And so you're thinking more about population health and health policy. Again, there is a lot of overlap between the two. If you get the MHSA, you're of course interested in population health as well. And if you get the MPH, you're also interested in healthcare institutions and how they can affect population health as well. Now, when we admit you into our program, you will check off on the application whether you're interested in the MPH or the MHSA. And that's great. It's good to be thinking about what degree you'd like to get. With that said, when we admit you into our program, you're not tied to either the MPH or the MHSA. You can decide once you get here in the fall of 2023 which degree you'd like to get. So you can check one off right now in the next month or two when you're putting together your application, but we're not going to hold you to that. When you come here in the fall of 2023, then you can make a decision about which degree you'd like to get. And so I'm seeing here, I'm just going to pause for a minute. I'm seeing in the question and answer, we have a question from Arthur about identifying impactful partnerships that drive innovation. And can I speak to the program's capacity to cultivate creative problem solving and partnerships? And so I think you do that in a manner in kind of, well, both in the classroom and outside of the classroom. So there are a lot of student organizations that are working on creative problem solving that are related to health administration or health policy solving. There are things like case competitions where you actually have to be creative and do creative problem solving, and you work in partnerships with people outside of the department and in different areas. So I think those are some of the things you can do. Also in classes, there are a lot of kind of creative problem solving exercises where you will work on that. The biggest one is probably the final capstone project, where you're working in an interdisciplinary group to work on that. If you choose the MPH degree, also, you'll be working in an interdisciplinary group project throughout the first year related to social determinants of health. So, there are several opportunities for that. And I guess I'll say in both the MHSA and the MPH, you will learn a lot about social determinants of health, both in classes within our department, but also some of the other required and elective courses outside of our department, because social determinants of health are incredibly important to health in general. And it's just incredibly important. And if you talk to a physician and a person comes in and they've got some sort of health problem, the physician might say, hey, I can give you drugs A, B, and C, but really that person's problem might not be necessarily A, B, C. The problem is that they live in an area where they don't have access to high quality food, or they don't feel safe to exercise outside in their neighborhood. They might be low income, and so they have trouble getting transportation to and from their medical visits. They might not have health insurance, so they might not be able to pay for some of their medications. These social determinants of health oftentimes are even greater than the kind of technical medical solutions that we often give people in the medical system. Okay, so there are a few other questions here. And will you still be able to take on a healthcare executive job with an MPH, or is it unfavored? That's a good question. I will say the MHSA degree is more focused on people who want to be healthcare executives. With that said, some of our students who get and in fact, many of our students who get the MPH degree will get jobs in healthcare institutions, healthcare delivery institutions. And oftentimes, actually, healthcare delivery institutions like hospitals can be a great place to improve and influence population health. And so those can be great organizations for people with MPHs to work and help transform population health. So that's certainly possible to get an MPH and get a job as a healthcare executive. With that said, the MHSA probably is a little bit better choice if that is really your career goal, is to be a hospital executive or something like that. The MHSA might be a little bit better. By the way, I should mention here, please, thank you for entering the questions in the Q&A. If you have questions, please enter them. I'll try to answer some of them. Also, we have Charlita Daniels, our program coordinator, on here as well, and she'll be answering some of the questions as well. Charlita has her camera off, but because her kids might be running around in the background, we don't want that to be distracting. But we're really committed to talking to you here tonight, answering your questions. So we're please put them in the Q&A. I'll try to answer them. Charlita will try to answer them because we want to make sure that you have all the information you need to make a good decision about your future career. Okay, so I want to talk a little bit about the competencies that are covered in our curriculum. And we can think of these in kind of three main areas here. So we've got this on the three kind of circles here. These are all kind of part of the National Center for Healthcare Leadership, or NCHL, competency model. And again, they're organized in three main areas here. Transformation is the top kind of sphere. Then we have execution on the left-hand side and people in the lower right-hand side. And really they all tie together to help you make yourself a healthcare leader. So you can think about this. What is a great leader? Well, they have to have great people skills. I'll kind of go in here in the lower right-hand corner here. They've got to have great people skills and be able to work together. As a leader, you can't do something on your own. You have to actually be working with other people and directing other people and leading them in the right direction. So you have to have a lot of great people skills. And part of that is kind of interpersonal skills and self-confidence and self-development and self-awareness. And team leadership and team development, all those kinds of things. Those are incredibly important for health leadership. But you can't just have the people skills. You actually also have to have kind of transformative vision. And so that transformation is the top section here of competencies here. And we really want you as graduates of our program to transform the healthcare system. And so you have to understand how to do analysis in order to understand things, but also that kind of innovative thinking and strategic orientation. And then finally, you need to be able to execute in the lower left-hand corner. So you could have the greatest ideas, but if you can't execute, then that's not, then you're kind of spinning your wheels or treading water. And so we really want you to understand how to properly execute things as well. And I'll say, finally, everyone's going to have a mix of these kind of skills. We want you to have a little bit of everything, but keep in mind that not everyone who's a leader is going to be great at every single thing. And so another important part of leadership is understanding yourself so that you can find the right people to fill the gaps if there are any gaps. And everyone's going to lead in their own sphere of influence. So I have a certain set of skills and expertise. So I might lead in one area, someone else leads in a different area. And so we're all going to lead in our own sphere of influence and take ownership for different things and lead in different areas. Okay, so another important part of the master's degree program is the internship. And this is really putting the theory that you learn in the classroom into practice. It's not just getting coffee for your boss. It's actually supervised by a preceptor, and the preceptor is there to help guide you in a learning process. So this isn't, again, just getting coffee for your boss. And so again, so it's supervised by the preceptor. Most of these internships are paid. And just some example internship organizations here are things like hospital and health systems. Those are very common internship locations, but also some professional associations, like the American Medical Association, maybe, or nonprofit organizations, maybe local, state, or federal government. There are many different foundations, research firms, consulting firms. Consulting firms actually are very excited about hiring our graduates, and then other governments, non-governmental organizations, and some of these are international as well, if that's something that you're interested in. So I see another comment here from one of our attendees asking what this is for master's. Yeah, everything I'm talking about is really focused on the master's degree. We also have a PhD program, and if you're interested in that, I think we have another information session in about a week. If you're interested in the undergraduate program, the undergraduate program that we have is for it's a public health degree, so you'll get a breadth of learning in biostatistics, epidemiology, health behavior, nutrition, environmental health, and health management and policy. But you just go through the kind of general University of Michigan admissions process. All of this stuff I'm talking about here is very focused on the master's admissions process. So don't worry about that. If you're an undergraduate student looking to the undergraduate program. And then there's a question here about the MHSA MBA dual degree program. So we do have I can't remember if I have a slide on that here about dual degree programs. Well, actually here. So, one of the things I mentioned earlier was access to the University of Michigan in general. University of Michigan has 19 schools, colleges, and other units here. And as I mentioned earlier, there are popular electives in the Ross School of Business, Ford Public Policy, School of Engineering and Social Work, and other places. So you want to, talk to other students in other programs. That's great, and you can take classes in other organizations, in other schools, and work on projects. Like there might be some case competitions that involve people from many different schools. So it's great to be exposed to those other students, and also have an opportunity to take some of those classes as well. There is a dual degree program as well that we have with Ross, Ford, the engineering and social work, and maybe one or two other places, actually MD as well, where you can get a degree in health management policy, either the MPH or the MHSA, and then also get a degree in one of those other programs. Typically, the master's degree is a 2-year program, and if you do this dual degree program, it's 3 years, but you get 2 degrees in 3 years. If you were to do them separately, it'd be 2 + 2, 4 years. But if you do this dual degree program, it shortens that to 3 years because there's some overlap. So it is possible to do dual degree programs with us and with some other popular units on campus, like the Ford School of Public Policy or the Ross School of Business. So that's certainly a possibility. I'm not sure about Dearborn, though. So maybe Charlotte can answer that question from Maya about MHSA MBA program with Dearborn. Typically, if there's a dual degree program, that's with the Ross School of Business in the Ann Arbor campus. And if you think that's something that's of interest, well, let me step back. You don't have to do the dual degree program to take classes at Ross or Ford. You can take a few classes there without being a dual degree student. But if you're really interested in getting the MBA as well and getting more depth in some of that business education, or you're really interested in getting the Master's of Public Policy at the Ford School and really want more depth in that area as well, more time to take some more of those classes, you can get the dual degree. Now, in order to get the dual degree, you have to apply and be accepted to both programs, and that's a separate admissions process for either one. So you apply to our program, get in, you apply to Ross and get in, or apply to Ford and get in. You can do that now, so you can apply to those programs now if you're interested in the dual degree program, or you can wait a year and apply to those programs next year. If let's say you get into our program, you can you decide a year from now, hey, I think I'm also interested in Ross, you can apply to the dual degree program in Ross next year if that's something you're interested in. So during your first year at Michigan, at one place or the other, you can apply to one of the other dual programs if you think that's something you're interested in. A little bit more on where our alums go, where students go. These are some positions held by HMP alumni. So you should think about this. Are these the kinds of careers that you think, career roles that you think would be interesting? These might be good place, a good place for you to go. So, we have HMP alumni doing things like executive directing community health centers, working in national quality insurance, working at the FDA, working as legislative analysts for Medicare and Medicaid, being administrators of clinical departments, being CEOs or presidents of insurance companies, being analysts at hospitals, doing policy evaluation, being chief executive officers, chief operating officers, chief financial officers of hospital and health systems. There's just a meeting earlier this afternoon, again, with some of our alumni, and half of them in the room were, CEOs or former CEOs of health systems. So that's a very that's something that many of our alums are doing, and so it's really exciting to see them when they move into those roles. I kind of touched on a little bit, but one of the reasons why Michigan is a great place to be is the alumni. Again, our alumni association for the department is one of the oldest and largest of its type. Again, over 4,000 alumni across the North America and the world. As I mentioned, doing great things, and they're in all 50 states and over 30 countries. So here, of course, we're the University of Michigan. So of course, we have a lot of alumni in Michigan, but we have alumni really across the United States. And so, if you want to go live in the San Francisco Bay Area, don't worry. We've got, over 100 alums in the San Francisco Bay Area. Oh, you want to go and work in Massachusetts? Over 100 alums in Massachusetts. You want to work in Texas? We've got, about 100 alums in Massachusetts or Florida, a lot of alums really across the United States. And so don't feel like if you get a degree from the University of Michigan, it's going to be some sort of regional degree that's only recognized within 50 miles of Ann Arbor. No, this is a degree that, of course, is very well recognized within Michigan. If you want to be in Michigan, that's fantastic, but it's really recognized across the United States and across the world. And so we've got alums everywhere doing great things. And so a degree from the University of Michigan is not going to be limiting you to just living in the upper Midwest. And where do students go? We have a high number of students employed after graduation. This graph here shows really employed is employed in a full-time healthcare job, but then fellowship, internship, or residency, that's also employed full-time. And if you don't know much about fellowships, fellowships are actually pretty common. It's kind of leadership development within high-performing health systems. They will hire students that graduates that they think are going to be really high-performing leaders, and they have their own kind of internal leadership development that's paid. Don't worry, you're not being asked to go without pay. They pay quite well. And it's kind of a leadership development program within high-performing hospitals and health systems. So, both these employed and fellowship, internship, residency, they're all kind of employed. But if you're interested in a fellowship, that is a common thing that many of our graduates do. And then people are working in a wide variety of areas. About half are working in hospitals. And then here where it says university or college, actually a lot of the people involved hired at university and colleges are working in health systems for universities or colleges. About 10 to 20% of our students each year work in consulting as well. That's often a popular career path. Students do really well there. And those consulting firms really like to hire our students. Then some students go into health insurance or work in government or industrial or commercial firms or pharma biotech, nonprofit organizations, local and public health departments. Some of these numbers have changed since the 2020 survey. I think we have actually more in public health departments and nonprofits and more in consulting recently, but typically it's about half in healthcare providers and quite a number of consulting, and then a variety in other positions. And average salary, this is salary from a couple of years ago. I think inflation's probably risen, bump some of these up a little bit, but the average is about $70,000 to $75,000 per year as salary, and that's an important thing to be thinking about when you're investing your time and money into a graduate program. You really want to know: is this going to pay off? Am I going to be able to, if you're taking out loans, pay off your student loans? And actually, even if you're not taking out student loans, you're taking several years of your life out of the job market and you're investing in your career. And so you want to know, is that a good investment? Am I going to be able to get a good salary? And there's kind of the starting salary and then the salary trajectory. And our students do really well in that regard. And so that's something to think about when you're thinking about a position, a school to go to, is will this pay off? Will I get a good position after graduation? And with that, I think I'll stop. I've seen a lot of questions here in the Q&A. Please continue to put those in there, or let us know what additional questions you have. I put a lot of information here about how to reach us. Send some emails just in general, H&P admissions, or can send them directly to me. And we've got our website here, which you probably already know where that is. But let me stop now and stop sharing here so you can see my face a little bit better and see if anyone has additional questions. And Charlie, to put some information in the chat if you're interested in the PhD program. Yeah. Oh, so there's a great question here from Malak about work experience. I think work experience can be incredibly valuable, and in a program like ours, it gives you a lot of context. If you've been working, especially in healthcare, you understand, what are some of the challenges that you're facing in healthcare and public health. With that said, it's not required. And about half of our students that are in our program are coming straight out of undergrad, and the other half have some work experience. So it's a mix. We're looking for a variety of students. And I think if you have experience, that's great. That's fantastic. I think that background will be really helpful for you in our program. You'll have a better understanding of all the things you're learning in the classroom. You have that context to bring to what you're learning and kind of the theory in the classroom, but it's not required. And if you're, gung-ho and right out of undergrad, that's totally fine. 2 thumbs up. We're really excited to have you in the program. But if you have work experience too, that's great as well. It's not required, but I think that can be a really big plus if you have work experience. I should say, if you have 5 or more years of work experience, we do have an executive master's program, and that's one where you're working part-time and taking working full-time and taking classes part-time, kind of nights and weekends. And that's a great program for many people. So if you have 5 or more years of work experience, you can join that program. And we've got really fantastic students in that program. It's really great to interact with them. I love teaching them. They're fantastic, really great experiences. And they share those experiences with each other. They really bond together. And I think, they gain a lot of other program as well. So that might be an option if you have several years of work experience. But for students who, and really for anyone with any levels of experience, if you have 5 or more years of experience, you could also come to the residential full-time program as well. So a lot of different options available to you. Let's see here. So there's a question from an anonymous attendee. Are University of Michigan grads higher priority when applying? Not necessarily. No, we consider students from a wide variety of institutions equally. So if you come from, even Ohio State, we love you, we welcome you, we'd be happy to have you in the program. But we have applicants from a wide variety of schools who apply to the program. I will say, the University of Michigan is a great institution. And so if you're an undergraduate at University of Michigan, you're probably doing really well. And so we'll probably look on you favorably. But if you're from another great institution, we're happy to look at your application and consider you equally along with everyone else. So we're looking for great students from all over Michigan and elsewhere. So there's a question, I think, from Amita about the personal statement and essays. I guess I'll say, when I'm looking at the personal statements, I should say that the term personal statement, it can be a little bit can send some students off in the wrong direction sometimes. I think it's useful to understand some of the background of students, but don't overly dwell on your background in the personal statement. It's nice to have a little bit of context to what you're looking to do, but in the personal statement, I'm more interested in understanding what you'd like to do with your career. Kind of going forward, what do you want to do? And so part of that might be your background and what's motivated you to do certain things. But in the end, I want to know, what are your career goals? What do you want to do? And how can our program get you there? Because again, we're looking for fit. We're looking to see, is our program going to help you meet your career goals? If you want to be a sculptor, please tell us that in the application so I know that it's not a good fit. But if you want to be a population health leader, if you want to be a health organization leader, if you want to be a policy leader, tell us that in the application, in the personal statement, so I know that our program is going to help you along that career path. So that's a key thing, I guess, I would recommend for the personal statement is, what are you looking to do in your career and how can our program help you get there? Let's see, a few other questions here from Kinsey about the MHSA program. Are there any resources for the first-year students to get set up, the second-year students or alumni to help navigate the program? That's a great question, and we have a lot of support for our students. First-year students are paired up with a second-year buddy to help them kind of navigate the program. You also have an academic advisor. You also have people like Ms. Charlita Daniels, our program coordinator, who will help you navigate things as well. We have a professional development class that you take, so that should be helpful for this first year students. And then finally, we strongly encourage students to get paired up with an alumni mentor. I think the alums are really fantastic resources, even if they're they might not hire you for an internship or job, but they can at least give you some career advice. Typically, they're graduated 5 or 10 years ago, and they have some good early career advice about what to think about in your career, what type of jobs to think about applying to, internships to think about applying to. Also help you think about what classes to take. They say, hey, look, I really like this elective at Ross. You should think about taking it. I really like this elective from Professor Hutton. You should take his class. So they can give you, or you should join this student organization. This student organization is really great at helping you progress in your career and develop as a professional. You should do these case competitions. They're incredibly valuable. The alumni mentors also have a lot of great advice as well. So that's a great question. There are a lot of resources, and we want you to take advantage of the other students in the cohort, the second year students, and also the alums. Again, they're really excited about helping our students. So they're really enthusiastic about working with our students. I think Melak has another question about certificates. Yes, the program does have some certificates that you can get when you're in our program. Of course, you're focusing in health management and policy, but you can also get several other certificates. The School of Public Health has a variety of certificates relating from like genetics, population genetics to we got some global health programs. Actually, the global health. We're so excited about that within health management policy. We have a special track within health management policy we call global health management and policy. So if you're interested in global health, that might be something of interest to you as well. So there are a variety of things, there are a variety of classes you can take outside of kind of health management policy, but there are also some certificates in things like informatics as well that might be of interest to students as well. Let's see, I think that looks like most of the open questions. Please submit any additional questions you might have. I'm happy to answer them. And Charlene also is answering them in the chat as well. Okay, I see another question here. If I wanted to be a patient service representative, would the MPH path or MHSA path be better suited for me? That's a good question. I think you can go either way. If you want to be a patient service representative. I mean, I think the MHSA would give you a good insight into the organization and management of healthcare organizations. So you'd have a better understanding, for example, of what hospital systems are doing and what the what the motivations are within the hospital health systems. What are the key things that they care about and that drive how their organizations work. The MPH also would maybe give you a better sense of kind of population health, social determinants of health, that might be affecting patients and kind of bigger picture health system or population health and public health system resources available to them, and maybe policies that need to be changed to help patients. So I think you could go either way. And again, with the MPH and the MHSA, there is a little bit of overlap between the two. So if you get the MPH, you'll also learn a little bit about organizations and management and a little bit about accounting and finance. And if you get the MHSA, you also learn a little about population health, social determinants of health. So you're not necessarily limited one way or the other. I don't know if Charlene has a different opinion. And actually, once you come here too, you talk to our students, or come. I think we're going to have some future information sessions with some of our students, and they can help answer some of these questions as well. We'll also, during the admitted students day, we'll have some student panels too. They can give you some advice as well about what their perspectives and opinions are about which degree might be better. I see another question here from Thea. Can you take law schools within an MPH program? So yeah, so if it is, I think it is possible to get a dual law degree and the MPH as well. So that's a possibility. Really, for any of these dual programs, you just get admitted into into both of the programs, and then we kind of find the way to make it work so that it's a little bit less time consuming for you if there are overlapping courses and so forth. I think Charlita might be able to answer more of the details of that. It's been actually a little bit of time, I think, since we've had a dual law MPH student. But yeah, that's a nice thing too. And you could, and the question, you could apply 1 year to the MPH for the dual degree. Yeah, so I think for that too, you could start your MPH. And so, a year from now, start the MPH, and then also apply to law school as well. Yeah, and something to think about. Oh yeah, so Charlotte just put a link in the chat about dual degrees. So there's a little more information there about the dual degree programs and how they work. Yeah, and so yeah, it's something to think about if you're interested in dual degree is do all those extra degrees. It's an investment of your time and money to do the dual degree. And there's a question about, is it worth it? And for many students, though, the answer is yes. So that can be a really great investment. It's not right for everyone, and but for some students, that can be a really great solution. If you really, again, in this case from Thea, maybe you want to be a public health lawyer. Maybe it is important to have an MPH and a law degree, and so forth. So, 1 degree oftentimes can be great for 90% of students, but for that 10%, the dual degree might be a really good choice. See, other questions? Feel free to put those in the chat if you have additional questions. Happy to answer those. Yeah, Charlie's putting some comments in the chat. Law school usually takes 3 years, and our degree is usually 2. So 3 + 2 is 5. So that could be 5 years, but I think when we overlap it into the dual degree program, it's 4 instead of 5. So you kind of save a year of time then. And that's typically how these dual degree programs work. Is if you add up the individual degrees, it'd be a lot of time, and we kind of subtract a year from that if you do the dual degree program by eliminating some of the overlapping requirements. Feel free again to add any additional questions that you might have here. Actually, let me just remind you of some of these ways to contact us. It looks like there's another question here. Do we have financial aid or scholarships for? Oh, good question about financial aid and scholarships. So, look, a master's degree is expensive. It's expensive to take to do the program. 2 years, not only of the dollar cost that the tuition is, but then you're not. Well, you could work part-time, but you're not really working full-time for a couple of years, and so that's a big opportunity cost as well. So it's important to think about scholarships, and the first thing I guess I'd recommend is look for external scholarships, because there are a lot of really great scholarships out there for students in a program like ours. But also our program, we do have a scholarship pot of money that we can give out to students. And we consider that the students for scholarships, I should have put that maybe on the diagram, after you, when you're considering your admission, we're also considering whether to give students scholarships, and if so, how much. Unfortunately, the scholarship pool is not as big as we'd like it to be. Of course, we'd like to have a big enough pot of money to give everyone full free tuition. Unfortunately, we can't do that, but we do try to give students as much scholarship funding as we can. And we do that based on kind of 2 things: need and merit. So, we want to do what we can to encourage, the top students to come here. So if you are but we also want to encourage students who face barriers to kind of help remove some of those financial barriers to help students come here. So we do have scholarship funds. I will say the scholarship funds, our pool of funds for international students is smaller than the pool for domestic students, but we do have some scholarship funds for international students as well. And so that is something. And also, I guess the Techno Spark 7 had a question. I was also asking about kind of financial aid. And when you think about financial aid writ large, it's more than just scholarships. It might be loans, it might be work study. And so there are opportunities to work as well part-time while you're in a program like ours. You could work at the University of Michigan Hospital. It's a really big hospital system just right next door, basically, to our school. And that's oftentimes a great place for students to work, especially if they're interested in working in a hospital afterwards. And then also, you might work as a research assistant. I'm working with several research assistants who are master's students. So if that's something you're interested in, you can do that. And then there are other kind of off-campus job opportunities as well that are relevant to health management and health policy. There's an organization called the Center for Healthcare Research and Transformation in Ann Arbor, for example, that hires a fair number of our students part-time, and they're doing really interesting policy analysis work, so that can be a good option as well. And then, so yeah, anonymous attendee asks about scholarships and grants. So I think maybe Charlita can put a link to. I think we have somewhere on our website. I think we have a link of potential scholarship opportunities that are external to the University of Michigan, and that might be good to look at. And then again, we have some scholarship funds kind of within the School of Public Health as well. Then there's someone else here with what's your acceptance rate? And it varies from year to year, depending on the number of people applying and so forth. It hovers around 50% or so, I'd say overall. But of course it really varies. Like, there are some students that are not very well academically prepared, that it's not a good fit. They're looking to do something different than what we can provide, and for them the acceptance rate is 0. And then for the students who are well academically prepared and we think can really handle the rigors of our curriculum, and also this career path of health policy or health administration is really in line with what they're looking to do. It's a great fit for them. The acceptance rate is 100%. So it really depends on the student. We get a wide variety of applicants applying to the program. For some, it's not the right fit, but for a lot of them it is. And so for the students for whom it's a good fit in terms of their career goals and their academic preparation, I would strongly encourage you to apply. Let's see here. Other questions here. So the policy research organization is the Center for Healthcare Health Research and Transformation, or CHRT. So that's an organization that oftentimes will hire students. It was actually founded by one of our graduates of our department, Marianne Udall Phillips. She has a really great, interesting career. She worked in health insurance for quite some time and kind of rose up the ranks in health insurance companies, and then worked for the state of Michigan in the Department of Health, and kind of was leading parts of the Department of Health and Human Services within the state of Michigan. And then she decided she wanted to move into the policy analysis space. So she started the Center for Healthcare Research and Transformation, doing really interesting policy and health policy analysis work. So it's possible for you to, with a degree, to kind of work in kind of industry, if you will, and then work in government, and then work in kind of the nonprofit sector as well. And that's an interesting career path. I think, it's possible to kind of move around. And I think Marianne Udall Phillips is a great example of that. If you come to our program, she typically will teach one class a year on the health insurance system. And it's really, if you're interested in health insurance, and it's a great class. And actually, even if you're not super excited about health insurance, it's actually a really good class. I think, people sometimes discount the value of what's going on in the health insurance world. But actually, there's incredible opportunity for transformation within health insurance, and incredible opportunities to change the way we do health insurance, to incentivize and reward good population health and improvements in population health. So it's a really interesting area to think innovatively and transformatively. And there's some really exciting organizations that are doing that. Of course, there's some stodgy ones that aren't as well, but there's some really interesting things happening in that space. Yeah. Other questions? See, we're getting close to an hour. I see several people have dropped out, but I'm happy to answer your questions here. So if you have additional questions, please raise your questions. Okay. Yeah, Techno Spark 7, you had a question. Yeah, go ahead. I think if you unmute yourself, you can ask your question. I'm not hearing anything, but yeah, if you have a question, please let us know. Well, it looks like maybe you're running out of questions here. Yeah, please throw them in the chat if you have questions. If not, I want to thank you for your time here tonight. Really appreciate the opportunity to tell you about our program. Again, this is an opportunity for us to get to know you, and really more for you to get to know us and see if it's a good fit. And if you have additional questions about that, it's a big decision about what you do for several years of your life. Please reach out, hmpadmissions@umich.edu. Take a look at our website or send me an email too. Happy to answer any questions you might have about the program, again, and about the admissions process too. If you have additional questions about that, please let us know. It's been great to chat with you here this evening. Thanks for your time. And if you have additional questions, again, let us know. We're looking forward to seeing your applications and excited that you're considering the University of Michigan, and we hope that you apply and hope to see you through the admissions process. So thanks everyone for your time tonight.